Healthcare is a human right. It is not a human privilege. The health and the comfort of no American should be held hostage to the profit motive. We must take care of our sick and our infirm, or we, as a nation, have lost our soul. Hold our press conference today at Victory Memorial Hospital to discuss health care and the potential closings of the hospital and several Staten Island clinics, inadequate hospital coverage in this neighborhood, and the fact that Staten Island is the only borough without a New York City hospital. Most importantly, the need for single-payer health care, single-payer universal health care coverage for all Americans. My friends at the Progressive Democrats of America, the PDA, have coined the perfect phrase, in my opinion, to change our government spending priorities. Health care, not warfare. U.S. health care costs are more than $2 trillion annually, approximately $6,500 for every man, woman, and child in the entire United States. There are about 45 million Americans with no health care coverage whatsoever, and there are 50 million who only have partial coverage, not enough to really sustain them. People without health insurance die more often than those with insurance. There are 18,000 lives that are estimated to be lost annually that could have been saved had they been insured. And these are real people. That's enough people to fill Madison Square Garden. The cost of health care in America today is quite literally obscene. It resulted from the greed and the lobbying of the insurance and the pharmaceutical companies and the special interests. And the resulting lack of insurance threatens institutions like Victory Memorial Hospital here in Brooklyn and Richmond University Medical Center in Staten Island. It threatens them truly with extinction. My opponent last cycle, and again this November, New York City's only House Republican Vito Fossella, recently helped persuade the state government to release funds to pay Victory Memorial salaries until it is scheduled to close in this coming June. Now that's a good thing, and I applaud that effort. This community, Bay Ridge, has fought hard to keep Victory open, and it should do that. I supported that effort on Community Board 10. A congressperson has the potential to do much more, but Congressman Fossella won't because he can't. All too often, special interests determine how Fossella votes. The insurance industry has contributed nearly $300,000 to Vito Fossella, and the pharmaceutical industry close to $60,000. So is it really surprising that Vito Fossella would vote their way instead and against the interest of the people of Staten Island and the Brooklyn residents? The American Insurance Association gives Congressman Fossella a perfect mark, while the American Public Health Association, which represents the people of our nation, and it is the nation's largest and oldest public health advocacy group, has twice given him a score of 0 over the last 5 years, as well as a score of 12 and 2 scores in the mid-50s. In 2007, he ranked third lowest of New York's 29 members of the Congressional delegation. Why? The insurance and pharmaceutical industries control the country's healthcare policy agenda by using their purse strings to influence legislators like Vito Fossella. That's why healthcare costs Americans so much money. Healthcare comprises 16% of our gross domestic product, and it's projected to approach 20%. It was big business, and it is very big money, and the corporate interests want to keep it that way because it brings them money. I don't. A congressman can do much more, and he should, but Vito Fossella won't because he can't. There is only one right solution to lower the cost and increase the availability of quality health care in the United States. And because the insurance and pharmaceutical industries who support Vito will fight this with all their resources, Vito Fossella can never support it. The solution is single-payer universal health care.